Hello, my name is Patrick McGrath. I'm the Integrated Vice President of Research and Innovation at Capital Health and the IWK. Today I'm going to talk to you about translating research into care, or TRIC grants. That's research to change the health system. Priority in these grants will be given to applications that improve patient-reported outcomes, improve the safety of healthcare, identify and reduce unnecessary costs, reduce wait times for healthcare, reduce the need for healthcare, reduce unnecessary interventions, and improve access for underserved populations. So the purpose of the TRIC grants is to support research at the point of care that will facilitate the translation of clinical science into improved delivery of services and patient care. TRIC grants are meant to change healthcare at the QE2 and IWK now, not for some time in the future. Why TRIC? Well, because there's a huge problem in translating research into practice. And several people have talked about a valley of death between basic biomedical research and clinical science. But the second valley of death, from clinical science and knowledge to healthcare decision making and actual clinical practice, valley 2 on the diagram, is what we're focusing on in TRIC. The hallmarks of a TRIC grant is it has to be great research. The team has to be co-led by researchers, usually clinical scientists and administrators. The TRIC funding will cover the costs of research, but all operational costs have to be absorbed by the health system. We'll fund research that can be successfully implemented and sustained by the health centers. So the deadlines for the TRIC grants are May 1st and November 1st annually, and the foundations from the QE2 Foundation and the IWK Foundation are providing the support. There's 3 levels of awards. Up to $3,000 over 1 year is level 1, up to $30,000 over 1 or 2 years is level 2, and up to $100,000 over 2 years is level 3. The grants are reviewed by scientists, health center administrators, and representatives from the health center foundations, industry, and patients. We want to look at the impact on healthcare, the scientific and the administrative merit, the implementation plan. Is it feasible? Is it sustainable? And the budget, is it appropriate? Operational costs have to be signed off by the administrative co-leader. So the anticipated outcomes from TRIC are new diagnostic and treatment procedures, increased access to care in terms of timeliness, affordability, and quality, addressing issues of effectiveness and efficiency, perhaps at times adopting new technologies or generating new delivery models, addressing service gaps. For instance, mental health and addiction is one that has been identified. Improved chronic disease management and support systems, and responding to the needs of geographically or culturally diverse populations. In November 1st, in the first competition, we had 34 applications, and we funded 7 from Capital District and 8 from IWK. In the last competition on May 1st, we had 20 applications, 6 were funded from CDHA, and 2 were funded from IWK, but there's 1 still pending, and then 1 was funded from both CDHA and IWK. Patient engagement is a new TRIC priority, so we insist that you have to include the patient voice in all TRIC grants. The workshops will be available. Patient Engagement 101 is what we're calling it. If you're having any trouble figuring out how to engage patients, you can speak to the Citizen Engagement Advisors at Capital Health or the IWK Quality and Patient Safety Office. They can advise you. Why patient engagement? Patient engagement in research will improve the relevance of the research and improve its translation into policy and practice. It will contribute to more effective health services and products and will improve the quality of life of Canadians and result in a strengthened healthcare system. The basic system is nothing about us without us. We're going to have workshops to assist teams with application development. You can get consulting in grant development from the consulting scientists at the IWK and the research methods unit. And it doesn't matter which health center you're in, you can use either one. Also, I'd be glad to chat with anybody about their TRIC grant. Program leader for research and development at the CDHA and IWK, citizen engagement at CDHA, quality and patient safety. Research services staff are available, especially for things like pay scales, forms, research ethics, etc. Glad to pre-review your TRIC application if you submit it to us early enough. One of the things that you should do is check the eligibility criteria. Trainees cannot be the PI, but they can be a team member. You have to be a member of the scientific staff of the IWK or Capital Health. In the budget, you can use as many pages as needed for justification. You should pay attention to eligible and ineligible expenses. Use the health center pay scales for budgeting staff positions. The CVs should be 5 pages or less. We're not accepting the Canadian Common CV, but just a general CV. Forms, the TRIC forms are locked. To unlock the forms, contact Emily Walker in Research Communications at 473-5156. We'd like you to submit a paper copy, an electronic copy in PDF format to our email tric@cdha.nshealth.ca, or use the HITS Nova Scotia Send Secure File Transfer System for larger files. Submissions are due on May 1st and November 1st at 4 p.m. The guidelines and forms for TRIC are revised quite often. As you see, this is a program that's just emerging. So see the Research Services website to make sure that you've got the right forms. Submit a PDF copy and 1 paper copy. Don't send TRIC applications from a Gmail or a Hotmail account. Sometimes the software rules them out as spam. We've funded quite a few different grants from CDHA, and I'll give you some examples from the slides. So, for example, the impact of a web-based frailty portal in family practice for patients, caregivers, and providers, identification, screening, and appropriate care planning. That was Fred Burge and Lynn Edwards, and that was a level 1, a planning grant. They were just getting together to plan to submit another grant, and they may have done some work, maybe a survey, maybe other work, so that's why they needed a level 1 grant. Or the highly tolerant opioid patient, will a new paradigm of care improve outcomes, with John Clark and Karen Mumford, and again another level 1 grant. Other examples of other grants are, for example, Paula Bond and Graham Rocker put together one on expanding the Inspired COPD outreach program to the emergency department, assessing feasibility, efficiencies, and outcomes. Or the effectiveness of an online portal for the delivery of care to home dialysis patients, and that was Cynthia Stockman and Karthik Tenakor. These were both level 3 grants of $100,000. Some of the TRIC grants from the IWK included the Transforming the Emergency Mental Health Services at the IWK, preparing for an evidence-based prospective evaluation by Kathleen Pager and Marianne Hiltz, or Collaborative Models of Pediatric Healthcare for Marginalized Nova Scotia Communities, defining meaningful and measurable outcome measures. Other ones were Improving Transitions of Care for Complex and Medically Fragile Children and Youth, and The Mission is Remission, How Can a Disease Self-Management Website Change Care? Other ones have been funded by CDHA, the QE2 Foundation, and by the IWK Foundation. And then we funded one grant jointly between the two foundations, and that was the evaluation of the Nova Scotia District Health Authorities and IWK Health Centre influenza control policy. And that was actually by two academics from the outside of Halifax, but they are members of the scientific staff, and Steve Ashton and Mary Doucette. So if you have any questions, you can contact myself. I'm the VP Research and Innovation. My email is there, or Sandra Kroll, who's the Program Leader Research and Development, and her email is on the slide.